It's an evolution of a revolutionary device, but is it really ready for prime time? In this video, I'm going to be talking about the new UL2 or the new UroLift implant device as compared to the former first generation UL400. Hello, for those of you who don't know me, my name is John Lin. I'm a urologist at Gilbert, Arizona, and Sunrise Urology. I have been very fortunate to be somehow became the number one UroLift implanter in Arizona, having performed nearly 4,500 of these implants in patients. Recently, I had the privilege to demonstrate or to try the new UL2. For those of you who don't know or have not seen the UL2, this is the UL400, which is the first version of the UroLift implant device. And I have the sheath attached to it, and I'm going to show you why that's important. And as I talk about the UL2 versus this UL400, this is the first generation device. As you can see, the entire assembly is used once and thrown away, as compared to the UL2 it's a handle with a replaceable cartridge. So the handle is used throughout the entire procedure. You don't throw away the handle each time you fire the implant, but the cartridge is replaced. And therein lies the problem. There are a couple of major flaws with the UL2, which makes it a non-starter for me. So having used the UL2 recently, and I placed about 40 implants that one day using the UL2, I think for the new user, once they fix a couple of problems with the UL2, it's going to be a great device. But it's got a couple of flaws, which makes it less than optimal. First of all, once you load the lens into the UL2, you don't have to keep taking that lens in and out. That's a big plus because that lens is very thin and is subject to injury if you are loading the lens onto the handle wrong. You can bend it, you can crack the lens, making it inoperable, unusable, expensive repairs. You know the whole situation. So not having to keep taking the lens in and out of the handle is a big plus. I think it's more efficient because you're trying to line up that little lens into a small hole right here and try to load it every time you use one of these UL400, the first generation devices. That's always a risky proposition, and it slows you down. The new device, simply you replace the cartridge every time that you want to load a new cartridge implant to use on a patient. So it's going to be a lot more efficient with the UL2. Now, all right, so the packaging is also improved with the UL2. You no longer have a big old package that you have to dispose of every time you use an implant. It's a much smaller package and much more environmentally sound. Same thing with this implant device. You're not throwing the entire implant away, just the cartridge. So it's a much smaller carbon footprint, which is great. In addition, something that you may not have noticed or may not even care, but it matters to me. I like my environment, my operating environment, to be as quiet as possible. Every time you open up one of the UL400, the first generation devices, it's a big rip off of a big package. And during that time, I can't communicate with the patient and I can't communicate with the medical assistant. I know it's just a few seconds, but it just annoys me, that loud noise, plus the bulk and the trash that is generated from the UL400. Not ideal. Also, the small footprint of the UL2 devices allows my medical assistant to have a bunch of the devices stacked up, ready to go on a smaller tray. Versus the UL400, she literally has to step across the room to open up the large device because it takes up so much space. We needed a bigger countertop. So for the first generation, from an ergonomic perspective and workflow perspective, it's much better for the medical assistant. So these are some of the things that you probably had never thought of, but I notice every single step because I'm kind of like a follower of Kaizen and Six Sigma and trying to optimize the workflow no matter what I do. So those are some of the differences. Let me talk to you about the two major flaws, which makes me not want to use the UL2. And I will tell you, NeoTract's, the makers of the UroLift system, are working to fix the problem. Okay, so let me switch over to this device again. So this is the first generation device. I don't have the UL2 to show you, but when you put the sheath onto the UL, let's pretend this is the UL2. You put it on UL2, you have this lever right here, this latch that locks the handle to the sheath. On the UL2, this maneuver is very difficult. It is very, very tight, and you have to force the sheath back onto the handle before you can engage this in somewhat of a smooth fashion. It's difficult to latch this on the UL2. I actually handled the upgraded version. I call it UL 2.1. This is much easier on the UL2 2.1. So they fixed this problem right here. The second problem comes, it's a bigger problem. Because the implant is now a cartridge that mates with the UL2 handle, that interface has a little crack right here because the implant is mating into the handle. So that interface, that little crack, and then the mating of the sheath into this interface causes fluid leak. So when you introduce irrigation fluid here, not only does it want to go antegrade, it leaks out this way. So it's messier. I ended up having to use more irrigation fluid than normal. Typically, I can finish a 6 implant case by using less than a liter of irrigation fluid. But for the first couple of cases when I did use the UL2, I used more than 1 liter, a single 1 liter bag. So this leakage may also affect visualization, because if you can imagine, irrigation is no longer going into the bladder, but a lot of it is leaking out of the handle. That sometimes when you have a little bit of bleeding in the prostatic fossa, that impacts on visualization. So that is a big downfall to me. I also noticed a slightly more incidence of bubbles. As you know, as you're trying to tension the suture in that little tray as the last step, sometimes if you have a little bubble getting into that area, affecting your visualization, then you have to turn the irrigation on, turn it off, or wiggle the handle to get the bubble off so you can see the reflection of the light off the monofilament. Sometimes that slows you down if there's a bubble. So anyway, I noticed a little bit more bubbles than normal. So the irrigation leak leads to a messy work environment, a little messier work environment. More importantly, it affects visualization, and the bubbles also affect visualization. From what I heard, NeoTract has already come up with a solution to that problem. So I think in UL 2.1, I'm really looking forward to using that. In UL 2.1, I think it's going to be an even better product than the UL2. As of now, personally, I'm not going to switch over to UL2 because even though the pricing is the same for the implant device, the ergonomics are better. However, the latch issue and also the leakage issue, they need to be addressed because it impacts on so many aspects of the actual implantation of the device, of the implant into the patient. I think the results are going to be the same or better than the UL400 because the actual placement of the implants is pretty much the same. So as far as patient outcomes, it's not going to be affected, but from an ergonomic perspective, from a urologic surgeon type of a operator perspective, UL2 is currently not ready for prime time. And that's my opinion. Let me know what you think in the comments below. I look forward to hearing from you. Take care.